We're going to take a look into the history of modern medicine, the myths and lies that surround it and continue to permeate it today. It will never be free to be a true medicine because it's not based on the human cycles and human nature. It's based on myths. And to understand why it's not going to change, we have to understand the history of it and where it comes from. The basis for why they have the food dyes and additives and use poisons to cure a disease. Use a poison to make you sick in hopes that they can give a greater sickness than the sickness that you have, where the superstition comes from. Originally, the pickles were treated with additives such as iron sulfate to make them green, and then they used to color the cheese by using red lead, and then they used to add to bread to make it white clay, and aloe root, which caused constipation, and chalk to help make it white, and emollient. And then to beer they would add something to make it bitter so they wouldn't have to use as much hops, aconite bitter. Or to help it foam they used pig fat. In World War II, as you know, while we're talking about additives, we have these new words that are added that comes from nutrition and medical myths as well. In World War II, when the British were involved in the war, they couldn't get enough vitamin C or oranges and limes and lemons, so they had to use rose hips, and they call that hips. And they had to use hops to get the B vitamins, so they were known as an army that ran on hips and hops. And that meant a cheap army, an army that's not all up to professionalism. And so today we use that same slang to denote a part of our culture. We call that a hip-hop culture. But originally, the hops were used for the B complex, and also the hops were used to make beer. And these additives put in beer reduced the amount of hops that were used to just make the beer taste bitter, and people still think it has that same potency. Another additive that was used was in red candy. They used arsenic. So the Europeans have always used additives in their foods, and they will continue to do that. Now, let me show you some of these reasons why they were trying to improve their health by using these additives. Now, obviously, there's something wrong with a person's health. When you have these physical signs like a goiter at your neck, that means you're having a nutrient deficiency, which we call iodine. These are the signs of inadequate nutrition that the Europeans were suffering under. And this is what our ancestors saw when we first came in contact with the Europeans and the European doctors. They had many cavities, mottled enamel. This is caused by deficiency of vitamin C and phosphorus. And they started using another poison called fluoride to poison their calcium, magnesium, their bone ability to harden their bones, known as fluoride, which is a poison. They use that. That comes out of their myths and superstitions. And our ancestors saw Europeans with tongues that were red and painful, swollen, and purple. And this was due to the nutrient deficiency of their diet caused by vitamin B6, folic acid, iron, riboflavin, and niacin. And they had cracked and sore and chipped, chapped lips from their mouths. That comes from riboflavin deficiency. And the pigment on their faces, because they weren't getting enough oxygen, was causing cross-linkage, which we call liver spots, which means a deficiency of oxygen. And there's also a deficiency of protein. And the lips were inflamed or full of mucus. That's riboflavin again. And their eyes were sensitive to light or twilight, and they had poor vision due to vitamin A deficiency. And this is the nutritional foundation for the Europeans that our ancestors came in contact with, and also the diseases which the Europeans were inventing these dyes and additives to prevent. Unwittingly, they became fashions. The nails were brittle and ridging, easily broken and flattened. That's due to iron deficiency. And the hair was dull and brittle and lacked curliness. It was straight. That's because of a protein deficiency. Now, these are some of the signs and symptoms of diseases that were manifest by the Europeans that we came in contact with in history. These are the ones that our ancestors were seeing. They had dryness of skin, follicular hyperkeratosis, that's goose flesh, sandpaper skin, acne lesions, red spots, hemorrhaging of the skin, that's vitamin A, vitamin C, vitamin K, vitamin B12 deficiency, iron deficiency, niacin deficiency. And the bones, of course, were deteriorating. That's because of the calcium deficiency and not enough sunlight, which produces vitamin D to stabilize the calcium, along with a vitamin C deficiency. This was caused because of the poor nutrient content of the soil that was used to grow the plants that the Europeans ate. It wasn't given enough nutrients to stabilize their skeletal system, their bones, or their muscular structure, so they were wasting, and they had weaknesses and fatigue, and they were unable to move about so well because they didn't have enough muscular tone, enough vitamin C and thiamine, and their central nervous system was deteriorated because they lacked the nutrients to feed it, along with the vitamin B12 and magnesium, which you need manganese in conjunction with that, and zinc and tin and copper. And they had a vitamin B6 pyridoxine deficiency, which meant they were very irritable, and they had psychomotor changes, and they had psychotic behavior. These were the Europeans that our ancestors met. They had tremors, convulsions, behavioral disturbances, and of course they had liver diseases, fatty infiltration of the liver, which we call sludge, which stops the liver from acting appropriately up to its optimum level to produce energy. And they had, of course, many digestive problems, anorexia, gas, diarrhea, and that's due to the poor vegetation, the poor nutrient content of the soil, and vitamin B12 deficiency, zinc deficiency, niacin deficiency, and protein deficiency. And they had heart diseases, rapid heartbeat, congestive heart failure, enlarged heart. All this was caused because of the nutrient-deficient soil, which caused a need for them to find a medicine to cure this disease, and sparked their invasion into Africa. But they were cooking the plants. The plants were mostly rotten, and they were cooking them. And cooking further reduced the nutrient contents of the vegetation that they were eating. As you can see, you're losing about 50% of the iron by cooking. You're losing about 50% of the magnesium, and you're losing your phosphorus and your calcium. And all of these magnified the disease conditions of the Europeans just cooking the food. So they were a diseased lot when we met them, and their medicine was lacking when we met them. Of course, African medicine, this comes from the African background of medicine. The book by Dr. Charles Finch shows that our ancestors 4,000 years ago had perfected surgical operations. This is a successful surgery on the skull bone due to some kind of injury. This is 4,000 years before the Europeans were able to do any type of surgery. They're just getting to that point today. And of course, we were masters of herbology and the medicinal treatment of use for plants and herbs. This is Queen Hatshepsut's expedition, and she's transporting a myrrh tree, which is used for infections, is used for cysts and tumors, and people brush their teeth with it. This plant is mentioned in Egyptian papyrus as far back as 2000 BC. This is long before the Europeans were able to understand that herbs had curative properties. They were using mostly superstitions to treat disease. Here we see a 2,000-year-old drawing of a person being treated by a doctor, as you would call it today, for an eye injury. It's either removing a foreign body from the eye or instilling drops to strengthen or cure some condition of the eye. Down at the lower figure, figure 4, or figure 5 here, is the mandrake root being offered to Akhenaten by his wife Nefertiti. Mandrake is used as a purifier, it helps strengthen the muscles and give tone to it. And so far as this new wave, alternative medicine, chiropractic and bone adjustments, this is African science. You can see a gaping wound here. This was successfully treated and stitch on this mummy's abdomen, so that we had master surgical science. And then you see this bone adjustment, splits of wood padded with vegetable fiber surrounding a broken femur bone. We used herbs to help the healing, comfrey type herbs to help accelerate the healing. So we made our casts, as we call it today, out of herbs that were feeding nutrients to the bones and to the skin. The Europeans, of course, were using alcohol to treat many diseases. They called it a spirit. And this spirit they were taking to destroy the evilness in your body, to cause your bones to be broken, to cause you to need stitching, actually blocked the nerve endings and stopped these are nerves. The nerve is transmitting signals back and forth by using this Kepler and these substances to transport signals. And here's the alcohol coming in and blocking these sites so the signals can't go through. The Europeans believed that this alcohol, which deadened and poisoned the body, was in some way ridding the body of the evil spirit that caused the broken bone. Of course, Africa and our ancestors gave the world the words, the medical words that we use, such as liver, intestines, rectum, lung, heart, cardia, stomach, spleen, pancreas, kidney, bladder, phallus, prepuce, testicle. All these are African-derived words that we use today. It originated in Africa. There's a diagram showing where all these organs are located at. And our ancestors were masters of anatomy and physiology. And we also named the bones in the skeletal system. The jawbone, the sternum, the ribs, the arms, fingers, thigh, patella, calves, all of these are African words. The clavicles, shoulders, scapula, humerus, back, thorax, forearm, hands. Africa gave the world, did not give the world. Africa invented these terms. We're using the science of medicine long before the Europeans. All of this is at least 4,000 years old. We gave the word meninges for the brain, cerebrum, the convolutions of the brain. We gave the word brain, nasal fossa, nasal cartilage, lip, tongue, pharynx, thyroid, skin, muscles, spinal cord, vertebral backbone, as you would call it, larynx, clavicle, thymus, esophagus. I'm just giving you some background here to show you that long before the Europeans entered into medicine, we had perfected the science and taken it to a higher level. These are some of the anatomical terms for the cranium, for your head. The vertex, cranial sutures, bone, cranial bone, suture membrane, temporal bone, frontal bone, forehead, orbit, right? Mandibula, cheek, teeth, molars, chin, auditory, which means ear, and the body of the jaw. I just want to show you where all this science came from before we proceed further, and I'll show you the medicine that we have stopped following. We have stopped following the African medicine, and we've gone into the European medicine, which is coming out of an atmosphere of fear due to the volcanoes erupting and the landslide and the ice age. They believed that to combat fear, they had to use an evil fear, such as spirits, which you call alcohol. And because of the soil deprivation of the land due to the snow and the weather itself, they weren't able to get enough vegetation. And the ice age caused the nutrients in the soil to be washed out to the sea. Trying to grow enough to eat off of some rocks was very difficult, but that's what the Europeans were trying to do. And that's what caused those disease states that I showed you earlier. That's what caused the tooth decay, and the rotten skin, and the mental illness, all of which was what we came in contact with when we met the Europeans. Now I want to show you some of the conditions. That over here we have a balanced oxidized chart. That means the calcium, magnesium, and sodium, potassium is balanced. That means you're in a healthy condition. But when you don't have that in the soil, you get an imbalance. A number of health conditions which are often associated with slow oxidation, imbalance of minerals, excessive fatigue, depression, dry skin, poor skin tone, acne, digestive problems, migraine, headaches, constipation, overweight, allergies, anxiety, hypoglycemia, diabetes, rotten bones, osteoarthritis, heart disease, muscular dystrophy, multiple sclerosis, and asthma. All of that's associated with not getting the proper amount of minerals in your system. Chronic fatigue is premature aging. By balancing the minerals, you can eliminate or reverse the aging process. So the Europeans didn't live to a long time because they weren't getting the minerals and nutrients that they needed to sustain their health. And this is reflected in their medicine. So they resorted to a lot of treatment systems that we follow today. This is St. Gulliver freeing a sick monk of his devil. As you can see, they're ridding the monk who's ill of the evilness in his system, not by treating him, by making this concoction here on the table. And this concoction that they're making, allegedly, is going to cure the sick monk of his disease. And this is what they believe. Then I'll show you King Edward. This is the 15th century, 13th century, I'm taking you back in history of European medicine. This is King Edward Confessor applying faith healing. This is where you get that laying on of hands that you see on television with the ministers. You know, if they were really good at it, they would be at hospitals and not in church doing their faith healings, because they're needed more in hospitals. That's where they should go, those famous preachers on television. But this is King Edward the Confessor applying a faith healing. This is from a woodcut drawing. These are ancient pictures that I'm showing you, the actual pictures that the Europeans had. And this king is credited with having started the practice of touching for the king's evil, which is scrophula, tuberculosis of the glands of the neck. And he allegedly is curing the person of that disease. The laying on of hands. Now, this is a 16th century lying-in room in Switzerland. This is a woodcut. As I mentioned before, I'm using their original pictures here. In nearly all the old pictures of lying-in room, the nurse is shown washing the child. Frequently she has her feet immersed in the water to test its temperature. The human foot is a much more sensitive thermometer than the hand. So as you can see, they wash the child, but before that she puts her dirty feet in the water. As I showed you before, due to the nutrient deprivation of the soil, more than likely she had athlete's foot and other skin diseases. But first she put her feet in the water, and then she bathed the child. And this water, in this tub here, is the same water that they wash meat in, and the same water they had bowel movements and urinated in, because they didn't believe in sanitation at the time. So this is not clean water. This water is dirty. It's festering with manure, bowel movement, piss, urine, and they cooked with that same water. The hygienic system was introduced much later in European history. Of course, we as Africans have fully developed the system of caring for children. This is Egyptian women carrying their children. Remember, we had the Kindisa system, which you call babysitting or preschool system, intact at that time. For example, the Kindisa system is when you initiate a person into the order of babysitting, as we call it today, which is actually early childhood education. And the Kindisas or babysitters were able to cross lines of let's say, two warring tribes or groups. The babysitter from one group could go to another group and not be touched at all, because they were initiated in the cult and they were caring for the fruit of the tree of life. So they were carrying messages or ways to solve the crisis from one of the houses who were in conflict with Ashanti. The babysitter from the house would go to the Ashanti. The babysitting would not be stopped by the soldiers or anyone, because they were in a so-called supreme or religious cult, as we call it today. And they would carry subliminal message on how to solve the crisis from one group to another. But the British and the Portuguese saw fit to kill all the babysitters in Africa when they invaded the country in order to help destroy our civilization. But the Europeans learned from that the one way to increase farming and increase food production is to wall the cities. So walling the city was a modern technique that they used in the feudalistic period, which they learned from Africa. And they used to just indiscriminately throw the seeds on the land, and they learned to dig a hole and place the seed in it, and learned the cultivation system. The birth of Caesar from a 1506 edition of Suetonius. This illustrates the popular belief that Julius Caesar was born by a so-called cesarean section. In this time, the operation was not performed on living women, but only after death as a religious measure. They were not performing cesarean births, although we credit Caesar as being born that way. Cesareans were only performed on dead women. And that was because they didn't want the spirit of the dead woman to get into the child. It wasn't done for health reasons, and the child was usually dead. Again, this is old woodcut. This is the cholera epidemic, which is basically indigestion, or what you would call diarrhea. As I mentioned before, these were the diseases of the Europeans, which they believed spread from some contagious evil spirit. And this drawing shows how the doctors would make profit off a disease, the Board of Wealth, which they do today. They are continuing their practice in modern medicine, as we call it today. And this is pound the patient's gold. The pills are considered the way to make money. Give them these sugar pills and make a lot of money. Give them something that solves no problem whatsoever, which is what they continue to do today. The character of the Crusade indicates a popular belief of the past that physicians became wealthy as a result of epidemic pestilence. Rowlandson's drew a similar caricature showing physicians paying homage to influenza. In the Middle Ages, the physicians were sometimes accused of spreading pestilential diseases, since they were the only people who profited. Mortality among physicians during these epidemics was, however, extremely high. They believed that evil people carried these diseases, and sometimes they would hunt and kill people for having diarrhea. And this is an etching by Dumier. Although the cholera has long been known in the Far East, it did not spread to Western Hemisphere until the 19th century. Possibly invention of the steamboat. They want to blame this on Orientals, like they had their blame diseases on Orientals, influenza from various people from ages. They blame AIDS on Africans. They blame diseases on anyone but themselves. And this is part of their history, which I'm trying to show you here. In the years 1853 and 1854, the Asiatic cholera coming from Asia killed 150,000 people in France, and the same decade killed 4,000 people in New York City. Dying from diarrhea, from improperly eating, wrong combinations, which is still going on today. People are dying from diabetes, which is improper eating. This is tying a victim for the strapado. This is the Constitutio Criminalis Saracena. The victim, they have letters on it so you know this is the victim, as if you can't distinguish that. A rope is attached to his arms, was run through a pulley in the ceiling, and the executioner, by pulling the end of the rope, held the victim suspended from the floor with his arms twisted in their sockets. If mere suspension failed to produce the desired effects, the executioner pulled the rope and then released it suddenly, thus jerking the victim's arms. This was believed to help get rid of diseases in people. Similar to X-rays, which causes the body to deteriorate from cancer. All forms of x-rays cause cancer. They've just updated it. Now we move on to why we call doctors quacks. The plague doctor, costume used by physicians during the plague in Marseille in 1720. So they put herbs in the snout here, and that was believed to purify the air so that the doctor would not get the disease. And they called the doctors who wore these bird beaks quacks. This is also a German drawing of a character of a quack, or doctor with the beak for purification. Today we call those masks in the operating room. Those masks lose their effectiveness the minute they get moist. In other words, if they're on for more than 5 minutes, they no longer are effective. They're just a matter of the cosmetics of medicine, which are still going on today by the Europeans. This is a torture with the rack and candle. This was used to, of course, this is 18th century. They used that, of course, for justice, in that they would kill people that had the disease or put the person on the rack to cause the disease to leave. If they believed they killed the evil disease in this person, then no one else would catch the disease. So they would simply put you on the rack. Which they do today. This is applying the thumb screw. We want someone to confess that they spreaded a disease, started a disease. So they put their thumbs in this thumb screw and start applying pressure. I guess you can see that this one is the victim. They lettered things, the Europeans, and so you wouldn't confuse this person as being the victim. This is the victim with his mouth open, crying or screaming due to the torture. Let me show you what the thumb screw looked like. This is taken from the legal code prepared for Maria Theresa of Austria in 1768, in the order that her judges, some of whom were illiterate, might carry out the approved method of torture. The procedures were represented pictorially. This is the thumb screw, and this is what they turn the handle here to put these little nails into the hand to cause a person to confess that they started spreading diarrhea or constipation or cavities. Allegedly, they were getting rid of the disease that way. This is burying the plague victims. This is a poster published in 1665. It illustrates in London the plague and how they had to dig these massive trenches to bury the dead. They threw bodies in the coffins, but most, of course, were just naked and thrown into the graves. Here is the wagon carrying them to the grave site, which they threw them into the ground naked. Here's a dead person laying there. I'm trying to let you see the actual drawings. I use a lot of them. And this is in my ancient medical book that I read about the Europeans, which, of course, is out of print. I want you to know about this. This is the torture and execution of plague spreaders in Milan in 1630. This is a engraving. How they would torture people and kill them for having constipation or diarrhea. In the center, but further back, in the picture, the victims are shown having their limbs broken. They're breaking their legs here. You can't make it out too clearly, but they're breaking their legs. And they're bent to conform to the wheel, upon which they are also shown exposed. The exposure lasted 6 hours. They put them on the torture wheel and they broke their bones so they could fit around it. Just for spreading the disease of constipation or diarrhea. Remember I showed you those drawings earlier of our ancestors who perfected surgery and all those techniques, but during that time, the Europeans were still in caves. An earthquake that came before the outbreak of the plague. Disasters of various kinds were formerly supposed to be portions of the plague. before the plague of Justinian in 543 AD, the harvest failed, and there was an earthquake at Antioch which said to have killed 25,000 people. They equate a lot of events in the solar system, the lining up of planets, the lining up of galaxies. We're producing some sort of change on Earth itself. This comes out of the European mythical belief system. They believe the universe has caused its problems and not they themselves. And the universe is going to solve these problems and not they themselves. Now, you've seen the barber poles and all that, and the barbers used to do bloodletting. Of course, you remember George Washington they bled his blood to solve his disease, the so-called first president of the United States. This is a woodcut from a surgery published in 1517. The military experience was then the best training available for surgeons. Nobility brought their own surgeons, but the common soldiers were for the most part dependent upon the administration of their companions in arms or camp followers, who were usually whores, who usually took out the instruments to hear surgery, performing surgery by sticking this prong into the man's chest and pulling out whatever he thought was in there, an arrow of some sort. They had no medication for this, no anesthesia, none of that. The man simply had to holler. This is a 16th century amputation from a woodcut, 1517. This is said to be the earliest drawing representation of this operation of amputation. The amputations were frequent and continued so until Lister introduced antiseptics. He introduced being hygiene. Joseph Lester, as you call him, Listerine. He suggested people wash their hands and use clean water, boiler water, things of that sort. Before then, they were using dirty water and weren't washing their instruments or their hands, and they weren't given any antiseptics. So this fellow here just has to suffer. 99% of the people who had amputations died, but it would continue to be a very popular operation of the medical doctors. Here's another picture of the amputation according to Rawlinson. It was a very theatrical event. They had eating, they had dancing, they had singing done in amputations and autopsies in medical schools. This is in 1793. The medicine hasn't progressed that far, mind you. The superstitions are still around it. A rod for runaways, God's tokens of his fearful judgments, fondry ways pronounced upon the city for all persons both fleeing from and staying in it. They believe that these people have caused this disease and you have to isolate them and lock them up somewhere like they did with people that had leprosy, lepers, and with people that have AIDS. It's the same cry, the same so-called epidemic, and the same method that they use. This is in 1625. Behavior has not changed at all amongst the practitioners because it's based on the superstitious belief of the Europeans. This is a title page from the Fabrica of Andreas Versalis. Very good publication, published in 1543. It's one of the most celebrated pictures in history of medicine, entirely different from his predecessors in anatomy. Versalis himself performing the dissection instead of sitting at the distance and pointing out with a rod the organs. As you can see, the theatrical stage, the people sitting around, they had choirs, they had food, they had dancing, they had sexual intercourse. It was a very theatrical event. The amphitheater, the crowd of men and women, the students reading the book, and the dog and the monkey are probably conceptions of the artists they like to tell you, but according to their history, all this was part of the theatrics of having an operation or an autopsy or an amputation. They dance because they believe evil spirits need to be driven away. This is a fatal joust between Henry II and Montgomery. They ran at each other and a wound was poked into the king. and he was attended by Pere, and Versailles was called in for consultation. The king died, of course, because they still were not into the hygienic system, washing their hands, washing the instruments. This is all new to Europeans. I know you think it's been going on a long time, but all these techniques I'm talking about are totally new to Europeans, just in the past 150 years. This is William Burke in chains. Burke is the one who caused you to say burping when the baby, you burp the baby. That comes from this man. Burke was suppressed. He killed people by using a pillow put over their mouth, and it caused them to hush, and they would kind of get air, and they made this sound which people call burping. He basically was robbing people, a grave robber. He would kill people and sell them to doctors, and sell them for sacrifices, and sell them for eating. That's in a book called Race and Civilization. So that was during the time that the Europeans were eating flesh, eating themselves, which they still do. They buy testicles and parts of the bodies in health food stores today. Placenta, that sort of thing. They take it as medicine. They still practice a mild form of cannibalism. This is the skeletons of medieval death dance. Now you can see the Europeans' idea of how the body was shaped. See the pelvic girdle. See how they shaped it. This is how they believe the body was built in the 14th century, even up to the 17th century. You can see how inaccurate the anatomy is. Particularly striking is the bones of pelvis, as I mentioned, and the legs, what they think has some hinges on it. That's why I'm showing you the picture. This is how far behind they were in the ideas and understanding of health. And here's the fellow who kind of was acted as a revolutionary. This is Andres Vesalius from the woodcut appearing in Fabrica, his book of anatomy, published in 1543. A revolutionary, because he showed how the body was actually structured, and the church was against him for it. He was considered an evil man at the time. Remember that during this time the Europeans were beginning to get into flour. They were grinding the flour with mortar and pestle, which is like a hammer, and you put the grains inside of a stone bowl, and you grind on it. And the grindings from that stone bowl would get into the flour, and you eat the flour and wear away your teeth. They hadn't figured out what they were doing at that time, and so the flour itself was causing diseases, plus they were adding clay to it, which causes inflammation of the stomach and the gastrointestinal tract. So the food they were eating itself was detrimental. This is from the page of the Anatomy of Mundinus, written in 1316. It's first published in Puglia in 1487. Although this book is in no way comparable to the systematic work of Vesalius in the 16th century, it is evidence of the early attempt to revive human dissections. Because they wouldn't dissect the body to study it. They were too busy eating it. It's part of their history. Now, I'm going to jump a little forward here to the toilet. Because remember, the Europeans lived in caves, and they were having bowel movements and urinating in the caves. They wouldn't go out of the caves for fear of being attacked by wild dogs and wolves and animals and all other people being captured and eaten. So they would bowel move and urinate in their caves where they live, in their beds, and they'd be all on their floors, and usually full of filth and rats. And of course they would have urinations and bowel movements in the water, and drink and eat out of the same water, and cook their food, which they usually boiled because it was rotten. And this is a toilet, or water closet as they call it. You can see the dirt and debris in it on the tub and the water there floating about. I'm showing you the only drawings of this kind that the Europeans have in their history. They don't like to keep them around so you can see them. But these are the actual wood carvings. This is the wound man. This is 16th century first aid chart showing the location and nature of wounds occurring during war. These are the techniques the Europeans were using during war and when they if injuries were inflicted on each other or inflicted on Africans. This is a surgery of Ambrosio Paré, but it is in turn a copy of the much earlier picture. Therefore, no gunshot wounds are shown. Prior to the use of gunpowder, the majority of wounds received in battle were about the head and shoulders. But after the introduction of gunpowder, wounds of the body predominated. And this is a first aid chart. Remember that the food supply of the Europeans during this time was dogs and then cats and then rats, and then they would eat each other. That's why they always traveled with dogs and cats and rats, because rats was a stable part of their diet until they recently. This is a pair of mandrakes from an old woodcut. The mandrake was used as an ingredient in sulfuric potions and love filters. They were not using it for medical reasons. They were using it for a sex stimulant. Most of the herbs are used to rid the body of evil spirits or as used as a sex stimulant. Now we get into the birth of Eve in the first anesthesia, the first surgical operation incident used by Sir Charles Simpson. He was using something to get rid of the pain, and he put the person in a deep sleep, according to Simpson, in which Adam was cast, and it's quite evident that we're cut from the history of Hartman. See now, this is in 1493. It also shows how they're beginning to develop some understanding of anatomy. If you had a toothache, and you probably would in Europe, amongst the Europeans, because of the, as I mentioned, the stones in the bread and the nutrient-deprived soil and vegetation cause the bones to deteriorate. And this is 1823, and this drawing is showing that there was no way to get rid of the pain. The person simply had to suffer it. And the person pulling out the teeth could probably be a barber who, of course, used the same tools on the hair, and he didn't wash anything, mind. He used the same bloody tools he used on the other person, on that person. And, of course, they would bleed the person to get rid of the pain, too. We have to remember that we kind of think that everyone was doing the same thing we were doing in Africa, but that's not absolutely so. This is a priest carrying the sacrament to some dying man or woman. Attendants follow with tapers and holy water, and death leads the way with a lantern and a bell to announce the coming of the priest. With sound of this bell which distress symbolize. They were saying you probably deserve the death that you're having and the disease you have, so prepare yourself to die. That was all he was going to say to the person who was having diseases. This is the 13th century nurses with the swaddled children. It's showing how they banished their babies, and they usually wrapped them with this cloth, and they became immobile, couldn't move their arms or legs, and they usually had salt in the cloth. They salted it and wrapped them, feeling that would protect them from disease. They lost over 50% of all their children due to swaddling them in clothing. They call themselves resembling mummifying the child. And they believed the mummies were so preserved that they would preserve the health of the child, but actually they killed the majority of their children with this technique. Again, they're swaddling a child. This is the 16th century when this woodcut was made. You can see they tightly bound the child's head and bandage, and it was bound around and around and around and swaddling bandage until it was unable to make the slightest movement. And when they took it off, the child could exercise every few moments, but as I mentioned before, half the children treated this way died. This was a very popular remedy. You have to remember that over 75% of the children were dying anyway, so they thought that they actually came upon something to save them. The height of prudery, a physician operating under sheep. Remember, the physicians thought that the ladies were evil and they didn't want to touch them, and they wanted to protect themselves from the evilness of this lady. So he would wrap the sheet over them just for the protection of evilness. And operations were usually carried out blindly, as shown here. And they still cover us over based in operating rooms based on this myth and superstition. It has nothing to do with medicine or health. Continuation of their myths, which they label as science today. Hospital patient in bed with a corpse. This is a common occurrence in charity hospitals 2 or 3 centuries ago. This is an etching by Demir. If you went to a hospital, you more than likely would be in bed with someone dead or someone getting ready to die. And this was generally accepted as normal amongst the Europeans. I already went over the cesarean operation. This is just another drawing of the same. Actually, it shows that they haven't gone very far. They weren't using the anesthetic, they weren't washing their hands, they weren't controlling the hemorrhaging. Let's move on. A room in the Hotel Dior. This is a woodcut from the 16th century. The bed shown here in this hospital attended for 2 patients, but frequently had 5 or 6 patients in the same bed, irregardless of sex or disease. They were crowded into each other. The less fortunate patients found themselves in heaps of straw in a dark room or in the hallways. This hospital was indescribably filthy, as were all others at this period of time in Europe. They're still rather filthy people, the Europeans, the Caucasians. And many of our mothers and fathers and ancestors who have worked for them will tell you that. This is a crippled beggar, which is typical of European cities. Beggars and crippled, handicapped, blind, diseased people all over the place, rats, wild dogs running about. They were usually dungeons of filth. We remember that in 1869 beef fat was brought in, they basically stopped using beef fat and switched to oleomargarine, all of which caused sludging of the liver and increases diseases. Then around 1874 they switched to cheap vegetable oil. But they were used to this rancid taste of oil from the rancid taste of their meat, so they wanted to use that to flavor their bread, and they used rancid oil to make corks, to seal their bottles. So they got kind of conditioned to this rancid meat taste, and that's what they wanted in these sauces that you use today, the A1 sauce and all that, to imitate that oil that was used to wrap around goat skin bottles, that rancid oil. And the rancid oil they used for the corks that they put in the clay pottery, which they kept their wine and food in. It gave a rancid taste to the food, which you call today sauces, which they're trying to imitate. This is called Orange Girls, the laughing audience. And that's an obvious representation of the former relationship between theater and prostitution that occurred in medical hospitals with the Orange Girls, which you call nurses today. Nell Gwynn, the mistress of Charles II, who was applauded for a public statement of her profession as a prostitute. She was called an Orange Girl. And later they developed theater so that the prostitutes could show their wares and perform. Houses of ill repute, as they later called them. This is probably one of the most popular men in history of European medicine, Aurelius Theophrastus Bombastus von Hohenheim, better known as Paracelsus. He changed his name to Paracelsus, which means before God. And he said Hippocrates was no more smarter than his beard, and burned all of Hippocrates' books. Hippocrates was using the ancient African system of hygiene, washing his hands, things of that sort. But we're coming from a people that were very ill. And when they did come into Africa, they destroyed a lot of the land. They destroyed the land in Mali, Burkina Faso, Niger, Chad, Cape Verde Islands, off of Senegal, Somalia, Nigeria, Gambia, Kenya, and Sudan. They destroyed 25 million square acres of land, 25,000 square acres of land when they came in there in search of herbs and food. Here's another woodcut of the unicorn horn, where they believe this would give them to make them virile. The Japanese and Chinese still eat the bull's horns and the horns off of deers because of this fable, because they into a lot of homosexuality themselves. There's a piece of the horn in commerce, 15th, 16th centuries, were from either the narwhal or the elephant. And they believe these horns have curative property. Today they have sexual connotations with them, and you can buy them in health food stores. The objective is to keep the people into the myths, to keep them supporting whatever you're doing. As I mentioned before, all the land that was destroyed in Africa when the Europeans came in, the objective was to keep the poor in rural farms, in the farming areas, and not have them cluttered in the cities, because hungry people tend to revolt. International Crops Research Institute for the Semi-Arid Land, they say the land lost in Africa never can be replaced. The United Nations Environment Program says the land lost in Africa due to the Europeans can never be replaced. It's lost forever. Here's an advertisement of a very popular form of treatment, the clairvoyant or magnetic electrical physicians have recently furnished a house on Quincy Avenue in Quincy, Mass., where they are still healing the sick with good success, board and treatment reasonable. They advertise in papers to do this magnetic therapy, to heal people with psychic abilities. The extension of Dionne Warwick's and all those psychic hotlines that are going on that are not solving racism or oppression or disease anywhere on the face of the earth. This is animal magnetism, is what they call the African technique of hypnosis, by helping the person use their mind power. They call it animal magnetism when they learned this science from Africa. It was made popular by a man by the name Mesmer, and they call it mesmerizing a person when you hypnotize them. I don't know how clear this is going to appear, but this is all the deaths that occurred from disease and casualties during the plague of 1665. People were dying from colds, they were dying from fever, from pox, from flu, they were dying from grief, they were dying from head injury, they were dying from athlete's foot, they were dying from diseases which you think are very solvable today. They were dying from teeth disease, their teeth would rot, their jaw would rot. They were dying from ulcers, from vomiting, from dehydration. They were dying from sexual intercourse, breeding diseases. This is all going on in 1665 in Europe. And these are the people our ancestors came in contact with. This is James Graham, the proprietor of a celestial bed. A quack of the 18th century who developed a treatment guaranteed to maintain life to the age of 100 years. Nevertheless, people died anyway, quite young. But he used a celestial bed, solving your problems with the stars, which a lot of people do today. Now, if it wasn't for the new treatments that they have today, remember that there were many famines in Europe, famines every other day, and so they had to resort to grains to supply them with food because they didn't have the vegetation. The farmers would die, and there'd be a shortage of edible land that would cause more starvation, more of a famine. It would become an epidemic to a pandemic. And so they tried to make meat taste like vegetables. That's why you put lettuce and tomatoes on hamburgers, because they had a shortage of vegetation, so they tried to stretch the vegetables by making them taste like meat. And they used to drink rum and beer because they didn't trust the water, so many times they would be too drunk. The armies would be too drunk to fight. When they came into India, they called the port where they land Barbaricum, or barbarians, when the Romans came in. This is a woman delivering 3 devils from the work of Rossetti in the Church of Florence. They still believe that birth was evil and that women were originators of sin. And as her was giving birth to disease. This is Saint Radegone, Queen of France, exorcising a devil. They still perform exorcism, the Catholic priests do. This is from a woodcut drawing. I'm using the original drawings here so you can see exactly how they drew what was going on. So they're trying to exorcise this person of a disease. There's something wrong with the person's spirit. They had done something spiritually wrong, and therefore they had disease. The Africans have done something spiritually wrong, therefore they were enslaved. That sort of thing of blaming the victim. This is the effects of prenatal influence. Remember, they believed well, let me read this. These effigies were made to supply illustrations for history he had heard himself and seen neither the maid nor the infant. This white lady had a black child. This is what this drawing is about. And they believed that she had seen something that caused the child to be black. Either she looked at a lot of black clouds at night or looked out the window too much at night, and this caused her to produce a black child. This is the effects of prenatal influence that they believed in, or either the white ladies were promoting it to convince the men, or the men were using it to convince the women when they had the black children. This is a ceremony of purification after childbirth among the Siamese, which the Europeans duplicated, and they tried to purify the woman in her abdomen and stomach. This is a ceremony of purification after childbirth among the Siamese, which the Europeans duplicated, and they tried to purify the woman in her abdomen and stomach so she wouldn't have these black children anymore. And sometimes they would resort to various forms of torture. This is a birthing chair, a obstetrical chair in use. Reproduction of 16th century woodcut. This appears in the Garden of Roses for Pregnant Women by Ross Lee. This is a birthing chair, which is similar to how women are examined today, on their back and their legs. Put on these legs here, which you call stirrups. But that technique was devised by Henry VII so he could see the women having birth, because he himself was a voyeur. He got sexually excited by it, by seeing someone have sex or have children in his little short self. And this is the obstetrical chair. Obstetrical chair upon which women sat during childbirth is mentioned in the Old Testament. This is the one that is mentioned. The Greeks occasionally used a special bed or couch for this purpose, but the obstetrical chair continued in general use till the 17th century. It was often used as late as the 19th century. Many different types of chairs were designed, but the one shown here was recommended and used, more popular than the others. Sometimes when the lady was too slow with a contraction, they would lift up the chair and let it fall to the ground and drop her to the ground many times to speed up the contraction and speed up the birth. As it says, as I mentioned before, this was carried on long into the 19th century by the Europeans. They just start using the hygienic system of our ancestors. This is the ancient methods of hastening birth. This is among the Greeks at the time of Hippocrates, who was considered the father of medicine. The methods of assisting the parturient woman was direct and often brutal. The woman was sometimes repeatedly lifted and dropped on a couch. Uncivilized people still use similar, even more brutal methods to Europeans. Even today, to speed up birth, they use synthetic chemicals that cause the contraction to be too forceful and hard, deprive the baby of air. They call it oxytocin, which causes ancestral memory loss. They use chemicals to perform these same procedures today. And they call it modern because they're using chemicals. But it's based on the same myth, the same stupidity, the same superstitions. This is the ancient method of hasting labor. A variation of the method shown in the previous illustrations I showed you before with the couch and the chair, which was turned on an end and pounded against a bundle of faggots on the ground. That's where you get the word faggots from, which means sticks, which resemble a penis. And men who like other men's faggots or penis or stick were called faggots in England. And that's where you get the word from. So he was dropped on these faggots to stimulate the birth. These are Greek physicians doing this rough and brutal procedure. And this was done in the Middle Ages, the Renaissance, and up to the 19th century amongst the Europeans. They don't like for you to know their history. The book that I got this from is out of print, and you cannot find it. I probably have one of maybe 10 copies left on this planet. This is Hippocrates of Kush, the Prince of Physicians. Hippocrates is the father of modern medicine, as it says. He lived in the 5th century before Christ, but the principles he set forth for medicine weren't developed fully until the 19th century. They are still not using his system, which he learned from Africa. They are based on, this is part of the skull and bone ritual, which he was a part of the skull and bone clan societies. You have these clan groups, Skull and Bones, Trilateral, the Bilderberg group. All of those are part of the European clans, tribes that unify themselves with these rituals. And Hippocrates was a part of it, and he was also a practicing homosexual. And this shows the benefits of bleeding. The woodcut from the medieval poem of Salerno. That's where they have the medical school at one time, Salerno. To bleed doth cheer the pensive and remove the raging fires bred by burning love. They figure if this lady got sexually aroused, to calm her from being sexually aroused, they would bleed her. They would bleed you for headaches. They would bleed you for infections. They would bleed you for many reasons in medicine here in America. As I mentioned before, they bled George Washington as a means of trying to treat him. The system of European medicine has not changed. The myths have not changed. The techniques are different. But they're based on the same myths. I put him up here because this is Francostoro. In 1530, he wrote this medical poem entitled Syphilis sed morbis gallicus. This is where you get the word syphilis from his poem. As you can see, he's in one of those clans, which you call today Bilderberg and Bolet and all those primitive European clans, how they bond themselves with various rituals based on bleeding, based on homosexuality, based on white supremacy, which is the ultimate goal of their clans. And this is part of the symbolism involved in the clan he's a member of. The older medical literature contains many examples of supposed results of bestiality. This the belief that man can form hybrids with beasts still persists as a legend, and the face of which was like the father's was conceived in the imagination of the author. They still believe that the white man can breed with other animals. They still have sex with other animals such as sheep today. This comes out of their mythology, out of their occult groups, as you call them, the Bilderbergs, the Trilateral, the Bolet, and all of them perform such activities along with homosexuality, bloodletting, and human sacrifices. That's why they call it cockfights, and they still use animal terms when they talk about having sex today. Cockfight, bitch, and all these kind of terms that they use, which comes out of their old practice of having sex with animals. In the time of Queen Elizabeth, houses infected with the plague were marked by a green cross. During the later epidemics with a red cross. And the words were, love, have mercy on us. And the user meant, love, have mercy on us, prepare yourself to die. And the quarantine lasts for 40 days and 40 nights because it comes out of the biblical history of the Europeans. We, of course, us Africans, were, of course, using the hygienic system. We had ma'at and spirituality as a part of our birthing rituals and ceremonies, and this is from the Temple of Ethne, showing a natural birth in the squatting position, which is a natural position for having birth. The child, of course, is born as an adult, which means his royalty. And this position is the position used all over the world by colored people. Europeans are the ones who lay on their back, which decreases the blood flow to the child's brain and the blood flow to the pelvic girdle. And this is a symbol of ma'at and purity and purification, showing that this spirit, known as the baby, came from the spirit world. And this is the birthday of the mother. The baby is emerging from the womb, which is the emergency. I want you to have a grasp of what was going on in Europe and understand that we are still entrenched in the superstitions of the Europeans, and it's not going to go away in less than 150 years. They used the pus and stuff from, they were drinking the pus of the diseased people at that time as a form of vaccination and inoculation. And that's where they get these pus treatments that they put in your veins called vaccinations, because that was popular during that time. Someone who was dying and suppurating from pus, they take that pus and they would drink it so they wouldn't catch the person's disease. It has not gone away. They simply put it in a needle and inject it in your arm. You have to remember Queen Mary II drank a bowl of pus every day. These remedies have not gone away. They have just changed their form, but they're still entrenched in the mythology and superstition of Europeans, which you call modern medicine, which is nothing but a bunch of occult rituals and ceremonies. So I mentioned before, the modern techniques that they have was mostly the walled city, which protected their crops and allowed them to grow vegetation. They would burn the victim, burn the doctor that attended them, so a lot of doctors would leave town when a plague occurred. And this is how they thought of the brain, the ventricles in the brain, those fluid-filled spaces in the brain. The ventricles are the abbot of the soul, according to Albertus Magnus. He wrote Evil Magic and White and Black Evil Magic. And they believed these liquid-filled spaces in the brain was where the soul resided. They use the word psychic, which means soul today. They still think it resolves in that area. That's why they call it psychology, which means soul. Now, the Europeans believe they came from animals, and this is shown here. We had this embryo in the brain, this animal. They believe they had the reptilian brain. They believe they derived from a monkey brain, and they believe all that's in your head. Today. And since they think they are the center of the universe, this is where you get Europe. The oceanus, Arctic Ocean, the Atlantic Ocean, the Pacific Ocean. Now you have Europa. This is shaped like the brain. This is where the high thinking occurs in Europe. And the lower thinking, the reptilian brain, is Asia. And the animal brain, of course, is Africa. They simply put their white supremacy and racism into anatomy. They cannot escape their myths and superstitions any more than we can escape our African ancestry and culture. We are locked in our history and culture, and they are locked in theirs. They are not looking to be free. This is the ventricles of the brain, the dew, which you get this treatment called box flower remedies and dew water and mountain dew. That comes because they believe these vapors of the brain they could use to cure remedies, and they used to drink them as medicine at one time, and they switched to the dew water. Now they believe that the evil side of your brain is fighting the other side of your brain. The left hemisphere is fighting the right hemisphere, and this is what this is indicative of. And it's put in harmony. You see the zodiac symbols here. It's put in harmony here by the African principle here, which you have ma'at, the feathers, and you have the intertwining of the snake, the serpentine fire, using all this African symbolism. You have the moon here, you have the sun, the yin and yang, male and female, and it's being rescued by the bird, which you may call the ibis. All this is African symbolism. And they destroyed the evilness, the woman there. She's in the ground, and they buried her. Of course, this is explaining how the brain works. And this is still true in African and European psychology. They believe that you have this brain that tells you to do bad, and this part of your brain that tells you to do good. The myths and superstitions still continue today. And they try to explain the seven spirits, or what we call the chakras today, in the brain, the chakra effect in the brain. African people, of course, have 12 spirits here. The Orientals have 7, and Europeans have 2. And they're trying to explain the spiritual growth and development. They have the female principle, the male principle, the unity of all, Osiris, or the Star of David, as some call it. There's the moon, there's the sun, and these are the 5 ventricles in the brain. There's a half crescent. All this is going into the deep within the symbolism and the initiation into what you would call today the Bolet, Trilateral Commission, Bilderberg Group. All this is secret information that I'm showing you. The point that I'm trying to make is that the Europeans' myths and superstitions have not changed. They just changed, given themselves a new form to it, but it's basically still the same. Today we have these blood cleansings, these operations, these human sacrifices known as surgery, known as operations that cause a woman to have hysterectomies, where they're sacrificing her reproductive organs because of some evil spirit known as a fibroid or prostate disease. The mythology and superstition base of it all is still the same. You have a country here, such as America, that performs over 70,000 operations a day. Over 50,000 operations are performed in doctors' offices. That's 8 times more operations that are performed in any country in the world. The entire American army during the Vietnam War and the entire Vietnamese army would be operated in one day, equivalent to what is being done here in America. That would be operation on both armies. That's what's being done every day here in America. The high amount of operations are based in the superstitious belief of the Europeans that they can correct a problem that's caused by nutrition with surgery and bloodletting and all these ceremonies. The ceremony of putting the sheet over you, the ceremony of putting the mask over you is entrenched in that superstition, calling that spiritual forces. 85% of the people that get ill will get well without the help of a doctor. Stress causes a lot of illnesses, but we are medicated for it. You have stress of the brain, of the flat muscles of the brain, which causes headaches. You have spasms of the muscles. You have spasm of your chest muscles, which may cause asthma. You have spasms of the muscles in your blood vessels. It can cause high blood pressure. You can have spasms of the chest, angina, pectoritis. These are all spasms caused by stress and tension, which are caused the European doctors to give you medication, drugs. They try to drug away the problem with the evil spirit known as allopathic medicine. The problem with the allopathic medicine is that it's synthetic chemicals. The allopathic medicine used by our ancestors were plants. Allopathic technique is an African technique, but the way that Europeans took it to is called a spiritual worship of some evil force, and they're still in it. The most modern thing that's going on probably started in 1810 when they corked the bottle, and from there they progressed to a Dankin, which is tin, where you get the word tin from, who started the tin can, and from there they progressed into John Deere's metal plow around 1831, and then Borden started condensing milk around 1851, and in 1850 you got into the steam engine and refrigeration. All those are modern techniques to help improve the eating of the European, which got them out of the disease state that they're in. But they are still very much diseased today. Their disease rate has not changed since we met them. They still suffer from these deteriorations, and a lot of them are sped up by the medical profession itself, which is entrenched in a whole lot of secrecy and a whole lot of rituals that have no foundation in science whatsoever. Understand, you have white blood cells that supposedly protect you from diseases and infection. They protect the red blood cells, and the red blood cells have this melanin center in them. In other words, the white blood cells sacrifice themselves for the black blood cells. for the melanin-centered ones, for the red blood cells. White protects black color in the body, but the Europeans have reversed that process and have black people protecting white people in their armies and police force. This is part of the reversion of the process. But in nature, white is only there to protect black, to protect the color, and after that they die. But we are into a whole lot of rituals based on superstitions, the flat bread, the shape of the bread, the round bread, the upper crust. And we eat a lot of bread based on Sirius, the god that's supposed to come to protect you, which we call cereals. So we have a lot of breads that we eat coming out of European mythology. We have the flat bread, you have the cake bread, you have the cookies, which is a bread, you have the crackers, which is a bread, you have the flakes, which are flat bread, corn flakes, wheat flakes, that's another form of bread. We have the cereals, we have the chips, the corn chips, which is another bread. You have the tarts, you have the waffles, you have the pancakes. All this wheat produces a high amount of acidity, a high amount of deterioration of the body, because we into the bread, the Sirius god, that was brought to protect the Europeans. And we don't see that there's a spiritual basis and superstitious basis with all this bread that we're eating. Europeans tend to treat disease. They don't treat the people. You should treat the person, not the disease. But they treat the disease because they believe that's an evil force that comes at night, either from a cold wind, and they call it a cold, which you cough and sneeze and all that sort of thing. And then when you do sneeze, they think your spirit's going to fall out your nose and you're going to die, so the spirit stays in. They say, God bless you when you sneeze. It comes out of European rituals and ceremonies. We have to free ourselves from their history, attachment to their historical lies, attachment to their medicine, and start bonding again with African medicine and African history so that we can be healthy again. This is a brief overview of European medicine, a sick history, a history of myths and superstitions that have not changed and will not change any more than we can change from being African and change ourselves from our African rituals and ceremonies. We have to walk away from it to be healthy. And I hope this gives you some insight into where modern medicine is coming from and why they do the things that they do.